In healthcare, the focus is on the patient, but at Community, a team is making sure hospital staff also get the support they need. It's called the Resilience Response Team, and it's helping healthcare workers cope with the emotional toll of the work they do. Healthcare workers face trauma every day, and sometimes that stress doesn't stay at work.
We provide support to employees. There's lots of resources providing support to patients and families, but this service is directed specifically at supporting employees.
Katz leads the Resilience Response Team at Community, a group of licensed mental health clinicians who help staff process the stress that comes with their job.
We began to respond to incidents throughout the organization. The death of an employee, a traumatic incident involving a patient or something. And that was going well. And then COVID hit. And there was really a recognition on the part of the organization that we needed to do a better job at supporting employees. This was already a stressful type of work to do, but then add all the layers that went on with COVID. It just was so much more dramatic.
The resiliency team has been one of, I think, the best things that we've done ever.
Catrina Cullen is the director of critical care at Community Regional Medical Center and says she doesn't think her team would be as successful without the help of the resiliency team.
It really is one of those programs that helps staff with everything. So they're available for personal, if somebody has a hard patient that they're struggling with, or something was really devastating, they're able to meet with them, have conversations, and kind of help them through the moment.
The team can be requested for specific situations, but most of the time they can be found walking the halls, checking in, and just listening. The response from employees has been extremely positive.
I think initially it was an interesting thing because we had not deployed anything like this before. So I think initially people were a little scared to open up, but now it's really a neat dynamic because it almost feels like they're just part of our family.
There are certainly people in the organization that probably never talk to us, but there are people in the organization that talk to us all the time. And in fact, our team is assigned to different areas, and they get to know the clinician, the team member that's assigned to that area, and they look forward to being able to see them.
It's really easy to open up to them. I know staff they ask for them. If something happens, it's almost the first person they go to so that they can kind of deal with whatever it is that happened, and they can move on in a positive manner.
The team also responds when units experience loss, like with the loss of longtime patients.
Maybe there's a patient that's been on a floor for a number of days. Staff begin to develop relationships with those patients and those family members. And unfortunately, sometimes patients die. And it really affects the staff.
Catrina is thankful for the Resilience Response Team's constant support in the hospital, and that's what makes them this week's healthcare heroes.
They are heroes because they have helped every single nurse in all of the ICUs and the wound team. I cannot think of one person that they have not touched. If anyone has a bad day, they're the first people we call. They have made it immensely easier to do our job, to do a better job through taking care of ourselves.
And for Katz, it's about reminding staff that caring for themselves is just as important as caring for others.
Healthcare workers tend to put their patients and their families, and the patients' families first. And they put their needs second. And so one of the things that we're doing, we're kind of trying to fill that gap a bit, but also encourage them. You're important too. If you don't take care of you, it's like that thing on the airplane. They tell you to put your mask on first, because if you don't take care of you, you can't take care of someone else.